What does the future of the healthcare industry really look like, and how will that impact PAs? Hi, I'm Jenna Dorn. I can't think of a more qualified person to help answer that question than my friend Donald Fisher, President and CEO of the American Medical Group Association. He represents more than 150,000 physicians who practice in more than 400 AMGA member organizations. And 1/3 of all Americans are treated in AMGA member systems. Hi, Don. Thanks for being with us today.
You bet, Jenna. It's a pleasure to be with you.
You know, there's a lot of talk about moving to a value-driven healthcare system. Can you tell us what that really means?
When you look at a value-driven healthcare delivery system, it's one that's based on high quality and low costs. Today, our system is just the opposite of that. It's episodic care, patients coming in, getting treated for what they present with that day without real concern about comorbid conditions. In the future, actually today going forward, we're really looking at care that's delivered by teams, where it's patient-centered, where patients have a say in the care that they're getting, and it's value-driven. It's actually high quality and lower cost.
And what's driving this change exactly?
The recognition by everybody, employers, government, patients, and even providers, that our current system is not sustainable. The increasing cost each year added to each forward year is just not a sustainable model. So it's the fact that we need to reduce the cost of care, and we also recognize that the quality isn't what it could be. We could really improve quality and care in this country.
You know, there's a lot of talk about accountable care organizations, and in fact, hundreds of them are springing up across the country. Is that making a difference?
In fact, a lot of my members are participating not only in Medicare shared savings programs and the pioneer accountable care organizations, but also in commercial ones. It will make a difference. Accountable care organizations are organizations that provide care in a coordinated basis by teams of providers who are incentivized to improve the quality and lower the cost. And in fact, if they do that, they actually have shared savings that they'll accrue at the end of the day.
And do you think that that is a model that really has potential for the future, or what are the pitfalls?
I think it does, because it's focusing on population health, the so-called triple aim, where we have, managing the per capita cost of health care, we're improving the quality, and we're looking at populations. Accountable care organizations are designed to do that. You are responsible for the whole population of patients you're caring for, not just the ones sitting in front of you, but all the patients in your marketplace.
You know, it just seems to me that the PAs, their training, their experience, their DNA really makes them perfectly positioned to take that kind of holistic look at the patient, which it seems is the underlying value of an ACO. Does that resonate with you?
Oh, absolutely. In fact, the whole premise of ACOs is it's primary care based.
Right.
And it's cost efficient and high quality. Who's better to be at that table than the PAs? Because the PAs today cost less than a primary care physician. They provide high quality care. If they operate at the top of their license, they can provide real efficient care to the system. So yes, at the end of the day, when our focus is on improved quality and lower costs, the PA is perfect for the accountable care organization movement.
And speaking of costs, when we talk about reimbursement to the provider, I've been reading a lot, and PAs have been hearing a lot about bundled payments. What does that mean?
There's a lot of experiments going on right now about how to pay providers. Bundled payment is just one of those. And what they do in this case is they take all of the services, all of the providers, everything that's ever used to provide care for an episode or a disease condition, and they bundle it all together. And the premise behind it is that if we bundle the payment, it's going to force providers, hospitals, physicians, advanced care practitioners, all to come together to figure out the best way to care for patients, because at the end of the day, they're going to get one payment and they have to divide it up. And hopefully at the end of the day, everybody does well. So in the past, where you don't have a bundled payment, everybody does their piece.
Uh-huh.
But with a bundled payment, you come together and you say, what's the best way to take care of this condition over this period of time for these patients, and we'll get paid, and then if we do it well, we will do better as providers because we can keep the difference.
So it really drives team-based care that is the hallmark of the PA.
That's the whole basis for it. You bet, Jenna.
Great, great. Let's change gears for a moment, if we could, and I'd like to ask how you believe, from your experience, that PAs can ensure that they are, in this new model of care, appropriately remunerated and or recognized for the value that they provide
Sure.
to that team?
Well, it's all about being a good part of the team, working closely as a member of the team that's focused on what the team's outcomes and goals are for those patients.
Mm-hmm.
And so staying close, being a driver. I think the other thing that PAs could do in accountable care organizations and team-based care is take on the role of enhancing the patient experience. Mm. Today, we know that you're not going to get paid as high as you would otherwise get paid if the patient experience isn't good. The PAs are perfect for this. They seem to have more time to spend with patients, and many times they communicate with patients at a level that is much more understandable than that which is from other care members of the team. And so they could take on this role, and if they wanted to become an integral part of this system, taking that piece on in addition to everything else they do, and I think it's all about operating at the top of their license and getting people to recognize that they contribute a large part to that team.
Well, and certainly patient satisfaction has always been
Yes.
at the top of the list of the PA, and as they practice. Tell me a little bit about how it is that they are going to measure, in this new value-based system, patient satisfaction. Is it a survey after they're in, or how does that get calculated?
It is a survey. It is a survey after patients have had experience with the care team. It's also shoppers, the mystery shopper. There are actually patients that are disguised that go into these systems and actually relate their experience back outward to the provider organization and to the payers themselves. But there's something called the STAR rating that's in Medicare Advantage, plus there's the HCAP survey. These are all tools that are designed to really elicit from the patient what their experience was, and are they being engaged with their care? That's the other piece of it. It's not just the experience, but are they engaged? And who's better to get patients engaged than PAs?
Absolutely, absolutely. And it seems that in this team-based environment that is rapidly escalating in the changes that are happening, that there's a real opportunity for PAs to emerge even more as a leader in that team. I mean, with the new ways of measuring, with the
Yep.
big data, that sort of thing. How would you advise the PA professional to really operate even at a higher level than the top of their license
Yeah.
and be that sort of change agent?
Well, the success of the team is care coordination. And the PA is the perfect person to be at the center of all the processes that are going on with those patients. Oftentimes, the primary care physician will enter and exit to take care of a specific need that the patient has at that time.
Uh-huh.
But the PA is there throughout the entire course of treatment, and many times could be the care coordinator. I'd also say that, again, back to this patient experience, they really need to lock onto that very strongly because they're most capable of delivering that, and that's a key element to the success of the team.
Absolutely. You know, you've been a huge supporter of PAs, I know, throughout your career, but I know you haven't always been optimistic about the future of the profession. Can you give us a little insight
So
about
how
that
did you know
experience?
that? How do you know that? That's I was fortunate to be the first CEO of the AAPA back in the day, and back in late 1979, 1980, there was a report called the Gemini report that came out that said we are going to have an oversupply of physicians and an oversupply of primary care physicians. So this was a fledgling profession just getting started, and I looked and I said, well, if you're competing as a non-physician with a physician for patients because there's too many of one or the other, you're not going to survive as a new profession. So that's when I started looking around, and that's when I found my current organization, American Medical Group Association. But I was wrong. I was totally wrong. But the Gemini report was wrong too. There wasn't an oversupply of physicians. In fact, there's a shortage of primary care physicians like never before.
And are you optimistic about the future of the PA profession?
Oh, more than ever, because this whole premise of value-based care is about team care, and it's about primary care. And who better to deliver on that promise than the PA?
Well, we promise we won't hold against you that earlier misjudgment because PAs are thriving and they're growing like you wouldn't believe. So
Of
we
course.
really appreciate the partnership with AMGA and AAPA and you sharing your wisdom with us here today, Don. Thanks so much.
Well, thank you, Jenna. It's been a pleasure.